Welcome to the next seminar in the Practice in Action series brought to you by the Office of Public Health Practice, SAGE, and the Public Health Student Organization here at the UAB School of Public Health. Today, Ms. Katie Prince, a graduate from UAB School of Public Health in 2014 with an MPH in Maternal and Child Health Policy, is going to be talking about the Help Me Grow Alabama program. She's currently the director of Help Me Grow Alabama, and the purpose of this program is to connect families to health and developmental resources so children can start school healthy and ready to succeed. So help me in welcoming Ms. Katie Prince.
I'm Katie Prince, and like she said, I graduated in the MPH course, and I really, actually really weird for me to be speaking with y'all today because I was in that chair. But I really am so thankful for my time at UAB because I think it really gave me the practical skills I really needed to feel like I could add something unique to a job when I got out. I'm actually the only person in my office. We have about 15 employees now, and I'm the only person with an MPH degree. And I think I can tell that I do have a different lens a lot of times than other people in the office. And I think it's really benefited me just in my everyday to be able to see that big picture that we always talk about in public health. So, and just kind of wanted to tell you all how I got to where my position now. I definitely went into UAB, my MPH program, thinking, okay, I'm going to do childhood obesity. My undergrad was in nutrition science, and so I just thought for sure that is what I wanted to do. But when I got into classes, I was introduced to so many different areas. And then it was actually my internship. I really started getting interested in the early childhood development piece. And then my internship was with Autism Society of Alabama. It was actually a joint internship in the State Autism Council. And I absolutely fell in love with that world. I think when you think about public health prevention, you really, when it comes to early childhood development, I think that's one of the main pieces that we need to be focusing on. We know 85% of the brain is developed by the age of 3. We know that the experiences a child has in those first 5 years of life are directly impacting what the rest of their life is going to look like. I gave y'all, you have some handouts, but this is just a quick, I'm sure you've heard about the ACE study, but I think this is just a prime example of how important early childhood is and how it can show. The ACE study basically shows those the direct impact those early experiences can have on children in their later life, health outcomes later in their life. So, so I have an internship with Autism Society, and absolutely love that. I ended up interviewing the woman who shared an office with my supervisor, my internship supervisor. During that time, had gotten a federal grant. She's on part of a team that applied for a federal grant. And so I interviewed for one of the positions. I actually didn't get it, but then the agency that the position was going to be housed at, where I'm currently employed right now, about 6 months later, they had another position opened up, and I interviewed and I got the job. So I really went in, had almost no work experience, truthfully, and it's just been a great experience, though. And I'll tell you, I've been with the Help Me Grow program since I started, but we've definitely evolved over the last 3 years that I've been in that position. They brought me on as a state coordinator to coordinate 2 sites, and then within that time, we've received different funding sources where now I'm the director coordinating 9 sites. So it's been an awesome experience. And like I said, my experience at public health is just, I use it every day. Even though you might not think that you're going to use some of these things every day, it just randomly pops up where I use a specific skill or something I learned. So please don't hesitate to reach out to me if you have any questions at any time, because I know a lot of you are about to graduate, so I would love to let you know anything about my journey that might help you. So today I'm going to tell you about our program. what our mission is, and go from there. So I'm housed at a statewide nonprofit, the Alabama Partnership for Children. We do a bunch of different things. Our main mission is just everything focused on making sure kids and families have what they need for those children birth to 5 years old. So we have a Teach Scholarship program that helps support child care providers in getting their CDA or their bachelor's degree. We have the Learn the Signs Act Early ambassador in our office. Learn the Signs Act Early, I'm sure you might have heard about. It's a campaign with the CDC, all focused on making sure parents get information, again, to help support their child in those early years. And we have a bunch of different programs. But our Help Me Grow program, we have a blended funding. We're funded by the Department of Early Childhood Education through their preschool development grant. You might have heard, if you're in that early childhood world yet, a lot about the state pre-K campaign around our state. And so part of that funding supports our program as well. We're funded by the Alabama Department of Human Resources through the Child Care Quality Enhancement efforts of that department. And we're funded by the Department of Mental Health through a Project Launch federal grant. That grant really focuses all of their resources in the Tuscaloosa area, but it does set up some funding for statewide coordination. So a bunch of different funding sources, which means you have a bunch of different priorities a lot of times that are constantly changing. But I put this up there just to prove that I do use some things that I learned in school when I started this position. It was really up to me to figure out how to adapt this for our state, and I just thought, oh my gosh, we don't have a logic model. So I had to create a logic model. It was just so ingrained in me. So I still update this. We still go back to it. And you'll learn that Help Me Grow is supposed to be really simple for parents and providers, early childhood providers, but there's a bunch of things that we do on the back end to make it simple for parents. So this kind of helps us keep that big picture in mind and all the pieces that are fitting into the puzzle. Help Me Grow is a national model, so I think there's almost 30 states now implementing this model. It's evidence-based, and we became an affiliate in 2011, but we expanded statewide with that funding from the Department of Early Childhood Education and the Department of Mental Health in 2016. And it was really founded on the idea that we know children are eluding early detection. So a lot of times it's not until they get into kindergarten, or sadly even later, when someone's realizing, okay, this child is obviously behind, this child needs to be connected to resources, this child should have been connected to resources a lot earlier. We know that a lot of times initiatives exist that exist to serve young children and families, but providers don't know about them. If providers don't know about them, we know families don't know about it. So that was a piece that this model set out to fix. We know that child health providers, and really any early childhood providers, it's tough connecting families to resources. It takes time, it takes resources, it takes constantly being updated on, okay, what's the eligibility requirements, who's the best person to talk to at this resource. And we know that children and families benefit when everyone working with that child, working with that family, are communicating, they're working together to make sure that that child is getting connected to what they need. So all states implement this model for what works best for them. But there are 4 components that every state is called to stick to. But be flexible. So I'll go quickly through what those 4 components look like in our state for us. Making the connection. So this is really the heart of the Help Me Grow model. We do not provide direct services. We're just that linking piece to connect families to what they need. So in our state, we picked 211 Connects Alabama. Has anyone heard of 211? Okay. I didn't know about it either, but 211 is basically anyone in the state, in Alabama, can dial 211, they put in their zip code, and they're routed to a local call center. And it's basically a resource to help connect families to those basic need resources. So if they need help paying a utility bill, if they need help with food access, they can dial 211, and it's basically an information and referral resource. So we partnered with 211 to be that centralized access point and build out their early childhood resources. So now anyone can dial 211, ask for Help Me Grow, and be connected to one of our Help Me Grow care coordinators. There's a couple different things that set us apart. So we partner with 211, but a big value added of Help Me Grow is that follow-up piece. If you call 211 and you're calling for basic need resources, that general call specialist will probably give that family, a few numbers to call and say, okay, try this, call us back if that didn't work, if you still need help. But with Help Me Grow, we follow up on all referrals given. So once that referral makes it to the Help Me Grow care coordinator, we'll talk with the family, we'll discuss concerns, we'll help navigate services. We might fill that referral form out for that family and send it for them. We'll help coordinate appointments. It's really whatever that family needs. And that follow-up piece is really important because we know families just need that support. It can be confusing. Early childhood can be, that system can be very confusing, especially when you get into services like the school system or something like that. And so we really become advocates for families a lot of times in helping them navigate those systems, making sure they really know when not to take no for an answer, and just making sure they have all the best information. I love this diagram. It was drawn by a parent with a child with special needs, and I think it really just shows how time-consuming, how confusing a system can be for a family navigating these services. And so Help Me Grow is really supposed to be in the middle, being that person that's helping that family stay connected, making sure, again, they're getting everything they need for what's best for their child. And anyone can really connect a child or a family to 211 to Help Me Grow. Families, again, can dial 211 directly, but a lot of times we're getting families from referrals from physicians, pediatricians, we're getting referrals from pre-K teachers, child care providers, social workers, really anyone working with young kids, home visitors. So they can have the parent dial 211, but we have a referral form that they can send directly, and then we can start working with the family to get them connected. And follow-up doesn't just happen with the family. We also follow up with providers. A lot of times in the early childhood world, and probably all other worlds, but this is definitely my hat that I wear now. We always hear from pediatricians, from other early childhood providers that, well, we referred that family, but we never hear back. We never know what happened. And so they really appreciate that we're not only following up with the family, but we're getting them that feedback with the family's permission and saying, hey, you referred this family, we connected them to this resource. We didn't connect them to this resource, but we're trying this now. And so they really appreciate that feedback. Building the network. So, like I said, Help Me Grow, we don't provide direct resources. A lot of times, direct services, a lot of times that's a big confusion with our system. However, we know resources are out there that are doing screening. We know that there are resources out there doing the interventions, the physical therapists, the occupational therapists, the early intervention coordinators. But Help Me Grow, we're really meant to be seen as those arrows, just connecting families to each piece. And a lot of what we do relies on building relationships with all these other programs in the system. And these are kind of our big four when it comes to early childhood systems. But when it comes to early care and education, especially when we receive that funding from the preschool development grant and also the Department of Human Resources, that really called on us we were already statewide, but it really called on us to start targeting these early care and education, child care providers, pre-K teachers on the importance of early detection, the importance of connecting those families to supports as early as possible, but letting them know that we're here to help them in that process, to be that additional staff person, basically. Healthcare providers, a lot of times, families with young children, their pediatrician is really the only provider they're seeing. And so, working with those pediatricians, getting those referrals from those pediatricians is really important. And it works also the other way around. We'll get families that'll have a 4-year-old and they haven't been connected to a pediatrician yet. So a lot of times there might be some communication concerns, but it ends up where our first step is getting that family connected to a medical home. Part C and Part B services. So Part C is our state's early intervention program. Most of you are familiar with that, but those are the services meant for children birth to 3 years old. And so if we can get those families connected to early intervention, which is a free service, it's available to anyone in the state who's meeting that, they have to have a 25% delay in one area of development. We want to make that connection while they still can qualify for that service. So it works both ways though as well. We refer, early intervention is one of our main referrals. However, early intervention refers to us for those kids who are either aging out, so they're turning 3, and they no longer qualify for the services. Some kids progress out, but there's still concern there. So we can be that safety net to help, or for the kids that don't qualify initially, we can be that safety net to make sure, okay, they didn't qualify for this service, they're aging out, but what else can we connect them to now? In Part B, so that's our special education system in the state, and that's a whole other ballgame. So sometimes families qualify for early intervention, they receive these services, and they think it's going to look exactly the same when they get into the school system. But it's not the case. And some kids qualify for EI and don't qualify for the school system. So these are all pieces in the system that a lot of times families and kids are falling through the cracks. And this is where we want to come in and make sure that time does not go by when that child's not being connected. And then lastly, home visiting. So home visiting is an amazing service in our state, and we rely on it heavily as a main referral that we refer families to. It's getting someone into the home, working with the parent and the child together in their natural environment, and it's really bringing that parenting education piece to the table, especially when it comes to behavior concerns. When we get referrals, a lot of times our care coordinators do see it might just be a need for parenting education. Maybe the child just hasn't had opportunity to practice some skills. So home visiting is awesome because it gets someone in there, again, working with that parent and that child on strategies and just making sure that family is getting back on track if they need it. And the third component that we really focus on is provider outreach. So a lot of times we still have those providers out there that really don't realize the importance of those early years, those early brain development years. The importance of not waiting until they get to kindergarten or later in life to get that child connected. So we do a lot of education with anyone working with young kids on, again, the importance of early detection, connecting children to supports as early as possible. And one really core tool that we use to promote this message is, and also towards our mission to identify concerns early, is promoting developmental screening. In our state, we know 20% of children are at risk for developmental delay. Without using a valid, reliable screening tool, only 30% of those kids are being identified. But with screening, we can push that up to 70 to 80% of those kids being identified early for developmental delay. So in our state, we use a developmental screening tool called the ASQ, Ages and Stages Questionnaire 3rd edition, and the Ages and Stages Questionnaire Social and Emotional edition. The ASQ3 looks at general development, so it's going to look at a child's gross motor, fine motor skills, communication, problem solving, and personal social skills. And then that social emotional area is really going to dive deeper into behavior concerns. Both of these tools, what's unique about them is they're parent completed. And so we think that's really important because we always say the parent is expert on their child. And using a parent completed screening tool, it really sets that expectation that parents are going to be involved, that we value their expertise on their child. And it really can be parenting education in and of itself. So they go through, they answer these questions, and it kind of gets them thinking on important developmental milestones that they need to be looking out for their child. And people are using, we're lucky in our state that the ASQ has really been chosen as, in many different settings, that tool to use. So we're using the same language, but home visitors are using it, child care providers are using it, all first class pre-K, which is our state pre-K system, are using that tool, and pediatricians are using it as well. The AAP recommends that all children are screened at 9, 18, and 24 or 30 months. And so a lot of what we do is just making sure that that is happening. Any family that's enrolled in Help Me Grow, we ask that parent if they're interested in participating in our developmental monitoring program. So we start sending them those ASQs regularly. We'll send it, if they're 6-month-old, we'll send them at 6 months, 12 months, 18 months. Because developmental screening really shouldn't be a one-time event. Everything could be on track for a child. Something happens in the home, and six months later, it's a very different story. That child could regress. There could have been trauma in the home. And so developmental screening is meant to be developmental monitoring. It's really supposed to be a continuous process. And this tool is valid for 1 month to the ASQSE goes up to 6 years old. So, but with screening, we really have a professional responsibility to make sure, okay, we're not only identifying these concerns, but we're taking the next step in making sure we're connecting that child to services when there are concerns. And so Help Me Grow is really meant to be that follow-up to support providers who are already doing developmental screening and doing that follow-up. And we have a bunch of different activities that we do with developmental screening. We have an ASQ online screening component where now we used to send paper screeners to families, but we can send them home now, and they can easily complete that tool on their phone or online. We are constantly doing training, ASQ trainings for all of those early childhood professionals I've talked about. We do a great event called Books, Balls, and Blocks. It's a developmental screening event where we partner with anyone who wants to host. So a church, a local child care, daycare. And we set up 16 activity stations that are all focused around this developmental screening tool. And so parents can come, they bring their child, they get the screener based on their child's age, and say the parent isn't sure if their child can use scissors. A lot of parents don't allow scissors in the home. So they can walk their child over, we'll have a table set up with child-safe scissors, and they can watch their child practice the skill so they can better answer the question. And so we score the developmental screener on site, we discuss results on site, and then they're automatically enrolled in Help Me Grow for the follow-up piece. And now we've started an ASQ Enterprise program where it's basically our online data collection tool. However, we let other early childhood programs and providers become a user in this online system. So they can start developmental screening, they can track the progress of the kids in their program. And we're really contributing to, for statewide data on early childhood development that we really haven't had before. And again, the online system really just allows programs, it does automatic scoring, automatic age interval selection, and again, it lets programs see the big picture on where their kids are. And the last component of the Help Me Grow model is identifying those gaps and barriers, really the data collection piece. Because we know, I'm not sure even who said this, but we know what gets measured. You have to measure something to make sure it gets changed. So we hope that through Help Me Grow, we're going to identify, okay, what are the most common concerns of parents? What resources exist in the state, or what resources are there truly gaps, barriers? In this county, there's literally nothing for these families to meet the specific need. And we know there's areas in the state that those exist. How can we better coordinate between parents, families, physicians, service providers? How can we make sure we're engaging families at the earliest possible age? And what are the policy and funding needs to support every child in Alabama, making sure they get everything they need to succeed in life? And it really just comes down to most of our role and our job relies on communication. So again, communication with families, communication with all these early childhood systems that are working together. Like I mentioned, for Help Me Grow, it's really as easy. So there's all these systems, all these programs, but a parent only needs to remember, call 211, ask for Help Me Grow. Help Me Grow, which I didn't mention, is completely free for families, regardless of insurance, regardless of language. Really, we have access, all of our care coordinators have access to a teleinterpreter line. It's not ideal, but it does help, at least with that intake piece. And we have one bilingual staff person who does speak Spanish, and a lot of times she has a caseload now of Hispanic families as well. If anyone speaks Spanish, we can always use you. So just please contact me. And we like to say there are no wrong doors. When a family contacts us, yes, there might be a 6-month wait list for this resource to be evaluated for autism, or another 6-month wait list, or there's nothing available right now. But engaging that family, following up with that family, at least we start sending them those developmental screeners. At least it's someone that's going to start working with that family. And as soon as something is available, we're going to make sure that family's connected. And these are some of our care coordinators. There's a map, that poster, it's actually a poster, but it's our access guide to early childhood services. And it folds out into a 36 by 48 poster. And it's just a huge map on what early childhood system looks like in Alabama and where Help Me Grow can come in. And then our region map with regional contact information is on the back. So again, all of our care coordinators are housed at their local 211 agency. And we really felt like that was best for our state because they have that local presence. They can make those local connections with providers in their area. And they can make that local presence connection with families in their area, which is really important to build that trust. And again, so why would a parent call? Why would a provider call working with a family with a young child? If a parent everyone has questions. So if a parent had questions about child development, behavior, health, learning, if they really just wanted to start receiving the developmental screeners for completely free again, if their pediatrician did the developmental screener and identified a concern, they could connect with Help Me Grow again. Just help navigating services. They just want information on child development, parenting tips. And since our care coordinators are housed at that 211 agency, which is really, it was built to meet the family needs, those basic needs. A lot of times we'll get a family because of a concern for a child, but we really start working, you have to prioritize with families. And so if they come in, they also, they can't pay their utility bill or they need diapers, a lot of times that becomes our first priority before we can get that family to focus on the child. So being housed at 211, our care coordinators have access to a wealth of information and resources for their area. So we really don't just focus on the child, we focus on the family as a whole. And this is our region map. And this is just an example of a referral form that a pediatrician could fill out and send to us. They send it directly to the care coordinator This is just an example of the feedback piece. So at any time, a referring physician could request a report on all the families they referred to Help Me Grow, outcomes, the number of screenings that family has received. And then anytime a provider does refer a family, they should receive a letter on the right updating them on where that family was connected and where we are in the process at that time within 2 to 3 weeks with the family's permission. Help Me Grow in a nutshell. But I did want to say that we always are in need of interns. We house usually 2 interns. I know a lot of y'all are about to graduate, but we house 2 interns in our office in Montgomery. And our local care coordinator in Birmingham usually can house about 2 interns per semester as well. And I wish this would have been a great experience. I think I love my internship experience, but this would have been great because our interns really wear a lot of different hats. They're getting that direct contact with families because a lot of times, eventually they become extensions of our care coordinators. They are doing resource research on what's available in the area, so you're really meeting a lot of people through our outreach as well. And they really help us a lot with the data collection piece as well. So if you're ever interested, don't hesitate to call me. Call our office. Again, I'm located at the Alabama Partnership for Children, but our local care coordinator is located at United Way of Central Alabama in Birmingham.